currently got 829 patients in total in our hospitals, 48 in ICU, 33 non-ventilated and 15 ventilated. Again, Dr. Gerard will go through the breakdown of that, but what we are seeing and what we have seen since Wednesday is a decline each day of the number of patients at the Gold Coast Hospital. That is very positive news, and we are seeing some stabilising of hospitalisation across our Brisbane hospitals, in particular Ipswich and Logan, I believe. So that's a good sign. Doesn't mean the peak's over. Certainly in the next few days, we expect that with southeast Queensland, and of course the regions will be seeing their peaks in the coming week or two as well. So please, everyone, keep following those directions, wearing your mask, social distancing, and also if you have any symptoms, getting a PCR test or taking a rapid antigen test, and isolating and of course quarantining if you're a close contact. Our vaccination rates are now at 91.9% first dose and 89.31% second dose. So we are slowly creeping up to that 90% double dose, and I remind people once again, if you are eligible for your second dose, please come forward and get it. You can walk into any of our public testing clinics. Also, you can book into a pharmacy or a GP to get your vaccination. And that also, of course, applies to boosters. 51.67% boosters, 1,293,877 doses of boosters administered already. So that's great news. And our 5 to 11-year-olds, we're now at 29.6%, which is 141,684 5 to 11-year-olds. And again, can I just do a shout out to our 12 to 15-year-olds as well? It is still under 70% double dose of our 12 to 15-year-olds. Really pleased to see our First Nations rates are higher than that, but 12 to 15-year-olds out there, the numbers are still too low. These kids are going back to high school very soon, and what we don't need is them to be more at risk of contracting it and spreading it to others, and of course hospitalisation. Today, as I say, we are welcoming many medical interns across Queensland. 795 new medical interns are joining the front line throughout January, and I have 3 behind me today who are joining, I believe, around 30 at Redcliffe Hospital. And the 3 behind me will be covering ED, general surgery and orthopaedics this week. And I'm sure the journalists will be very kind to them, because they said today they've been more nervous than when they started in the hospital on Monday, because they're facing the media. So I've said they've got nothing to fear, because the media will be very kind to them. But can I give a shout out? Yeah, what a time to start as a new medical intern. It's an exciting time, part of a very long journey of studies, but of course they're starting in the middle of a global health pandemic as our hospitals are moving into their peak. Just an extraordinary time, an anxious time. It means they have to have and take precautions much greater than we've seen before in our hospitals to protect themselves, and also to ensure that we're protecting our patients and visitors to the hospitals. There's great news that about 56 of our medical interns will be Queensland rural generalists. So this is such an important part to boost our medical profession, our doctors in the regions, and it's been such a successful program. Our medical interns will complete 3 core term rotations in medicine, surgery and emergency medicine, plus elective terms in specialised areas. Also, since the 1st of January, we've had 60 new paramedics come online with Queensland Ambulance Service and 28 new communication staff, which is fantastic. This is on top of building 3 new hospitals, our 7 new satellite hospitals, where we'll be turning the sod early this year on those, and by 2026 having another 1,056 new beds coming online. So this all helps us prepare not just for dealing with COVID, but of course just dealing with the growth in demand and our population, the ageing population in Queensland. And as we've seen, hundreds of thousands of people moving to Queensland, calling Queensland home, means we have to have the health system that can provide state-of-the-art best practice healthcare for all Queenslanders. I'll hand over to Dr. Gerard now, and I'm sure our new interns would be happy to take some questions from the media as well. Thank you.
Thank you very much, Minister. Sadly, we have 15 deaths to report today. These are people who had a COVID positive test around the time of their death. Now, just to clarify, and I have mentioned this before, sometimes in people with multiple medical conditions, particularly older people, it can be difficult to determine what exactly what aspect of their illness and to what extent the virus played a cause in the death of that individual. But in the interest of transparency, we report all people who have died who have had a recent positive COVID test. So of those 15 people, there were 2 people in their 60s, neither of whom were fully vaccinated, 9 in their 80s, and 4 in their 90s. So just to, again, to summarise the vaccination status of the 15 individuals, 4 were unvaccinated, 4 had received 1 dose of vaccine, 5 had received 2 doses of vaccine, and 2 had received a 3rd dose. Hospitalisation rates continue to improve in Queensland. We are now down to 829 people in Queensland public hospitals. It was 928 on Tuesday, 889 on Wednesday, and 829 today. So again, a very significant fall. Now, most of that fall has been on the Gold Coast, as expected. So the Gold Coast, again, it is very clearly peaked and is on its way down. We believe that the greater Brisbane area, the rest of southeast Queensland, is approaching its peak right now. We are now here at Redland Hospital as we approach the peak of the pandemic here on the north side of Brisbane. In Queensland hospitals, there are 48 patients in intensive care units. That's slightly down from 51 on Tuesday, was 47 yesterday. 15 of those people currently are on ventilators. Here at Redcliffe, as we approach the peak of the pandemic, there are 39 inpatients with COVID-19, 2 of whom are in the intensive care unit. I'll now hand back to the Minister. Thank you.
Minister, the case of Derek Jewett has been in the press for the last few days. The family feel that he would have survived if an ambulance had been there sooner. Is that case going to be referred to the coroner, or what investigations are happening with that case?
Absolutely. My understanding it will be, and there'll be an internal review, as there always are with any of these with Queensland Ambulance Service, where they go right back to the initial call, the times, what code they allocated, everything that occurred to see if it was a contributing factor. That's what should occur. My condolences to the family. It's an awful, awful situation that none of us want to see happen. And of course, we want to know if there was a contributing factor as far as delay to the hospital.
Was it a case of just the hospital being overwhelmed?
Look, I can't say at this stage. There's a lot of detail to work through, and it's not for me to determine the clinical outcome and the reasons behind it. We'll wait till that's been done by the relevant authorities and see what the report says. And, the coroner's reports are always public, as it should be, and we'll all know whether that was a contributing factor or not.
Minister, the Nurses Union says that Queensland Health has ignored documentation advising that COVID-positive health staff who are asymptomatic can go back to work. Can you give us any more details on that?
Look, we're working through this. I know the QMMU lodged a dispute around this. We've been working with them for a number of days on this protocol. It's important to understand, yes, the protocol talked about in the worst case scenario whether asymptomatic positive staff are brought back to the hospital. That is in the highest level, most extreme circumstances. But it also talks about close contacts, asymptomatic, negative test, fully vaccinated, and those are the ones we're bringing back at the moment. I think yesterday's figures there were around 300 close contacts that were brought back into our hospital system who meet that criteria, but we have not brought anyone back who is positive. And I'm hoping, based on the positive signs we are seeing at the moment with the stabilisation in some of our hospitals in Brisbane and what's happening on the Gold Coast, I'm hoping we will not need to exercise that protocol, but we'll continue to work with the unions about that.
What is that worst case scenario? Is that when we hit those tier 4, tier 5 levels?
No, it's tier 5 and beyond. Beyond tier 5 is your triage hospitals. What the Premier showed in 2020, the ability to pop up portable hospitals at a convention centre, that sort of thing. That's tier 6. Tier 5 is extreme levels. We don't have any of our hospitals on tier 5. We have Torres and Cape, but only because of just the First Nations people and extra precaution around that, not necessarily about hospitalisation numbers, but most of our hospitals are at 3 and 4 at the moment.
How many on tier 4? How many are on tier 4 at the moment?
Pardon?
How many are on tier 4 at the moment?
Look, I happily to get you those figures. I think there's about 4 or 5 of them at the moment. Look, I'm feeling optimistic today. I haven't felt that way for a few weeks now, but looking at the numbers over the last 48 hours, seeing the drop in patient numbers, even our furloughed staff, we're just seeing a bit of a trend happening there that makes us think this isn't just a blip, that we are potentially over that peak on the Gold Coast. But I don't want us to get complacent. We've got more to go. Oh, look, the Gold Coast worried us because their vaccination numbers certainly were below the rest of southeast Queensland and in fact below most of Queensland. I'm still worried about our First Nations communities and we continue to work with all our First Nations facilities and to, so many people who are helping us, trying to get the message across the importance of vaccination, including our mayors. And I want to give a shout out to our mayors and our remote communities who continue to work with us about finding new ways to encourage people to come out and get vaccinated, because we know that is the most important measure we can be taking in these communities right now. No, and we haven't been reporting these daily because the families have specifically asked us not to identify them, and we respect the cultural needs of not recognising any particular individual, even giving their age or their gender, and these families have asked us not to do that. So there will be definitely, a time where we will say how many, but at the moment we don't want to on a daily basis be recognising that and not showing respect to their culture. Oh, they're absolutely included in the total figures. We're just not breaking those figures down as to how many. We'll discuss all of the recommendations in the report at Cabinet. No, I'm not aware of that.
Minister, Derek Hewitt's daughter has texted through and says the health system is coping, as the government says, and hospitalisations are less than what is expected at this point. Do you think it's acceptable for a 65-minute ambulance wait?
I think, it's important for everyone, when we talk about that we are prepared and planned for COVID, it shouldn't be interpreted as our system are not under pressure. Of course, COVID's putting pressure on our system. We had 9 wards dedicated to one single disease on the Gold Coast out of 25 wards. That has an impact still. We have never said, well, it's business as usual and there's no problems with demand. COVID has absolutely put a demand across our system, which is on top of our existing demand, which is why we've been talking to the Commonwealth about long-term reform, both in primary, allied healthcare, as well as our hospitals, because even once we move into truly living with COVID as part of our everyday lives, those demands that we were seeing before COVID will continue to exist. Our ever-increasing demand on our emergency departments because people can't get in to see a GP, that they can't get a specialist. So all of those pressures are still there. COVID has added to that pressure. When we talk about managing it, it is talking about not having to make those critical decisions as to whether someone should get, a ventilator, an ICU, all those sorts of things, and a bed. But there is continued hospital demand. There's continued a demand on our ambulances. There is no doubt that that demand continues to be there, and every single state is seeing that. Every state is seeing that, and I would wish nothing more than every ambulance turn up within the time that we hope for a Code 1. But sometimes there are extra demands that don't allow us to do that.
I guess you're right. It's a very complicated issue, and it goes right throughout the whole health system. I guess for this family who aren't aware of the complex issues that are in the health system, they just see their father died after waiting more than an hour.
None of those reasons help those families right now. None of that. It is devastating. It's a loss of life. We want to do everything we can to prevent loss of life, and our paramedics do an incredible job. And I, as the Health Minister, will continue to work with our health system, with our stakeholders, and with the Commonwealth to try to find a better path forward to make our health system more sustainable in Australia. This isn't just about Queensland. Yeah, and look, I can understand that. I can't say, what the reason is in that particular incident, but I understand the family wants answers, and that's why, this will be thoroughly reviewed and investigated so that they can get answers. No, they're clinical matters, and they will work through that review, and I'm sure keep the family informed. I know they've offered support to the family, and of course there'll still be the coroner's report to come out as well.
Do you support the Integrity Commissioner's call for investigation into the COVID?
Look, I haven't seen that call. The Integrity Commissioner has, as I understand, notified of her resignation and is moving on to another job. We're very proud of the transparency that we have had since we came into government. It is this government that actually brought transparency around political donations, that ensured that the CCC had true independence. We've got to remember what happened under the previous government, sacking a PCCC, because they didn't like what was being said. We have made so many changes in this area to ensure that there is transparency, and the Integrity Commissioner plays a very important role, and all of us work with the Integrity Commissioner, and the Integrity Commissioner supports members of Parliament as well as public servants to give them guidance and support, and to assist us in doing our roles in the best way we can. Oh, look, I'm not going to speak for the Premier. I'm sure you can ask her those questions. She's had plenty of questions on the Integrity Commission over the last few days, and she's answered those questions. So, the Premier doesn't stand up every single day to give the COVID update. I think I'm more than capable. I've been doing it for 12 months now, and I'm here celebrating the fact that we've got medical interns, and that we are expanding our medical workforce in all of our public hospitals in Queensland, and that's something to celebrate for today.
Oh, definitely becoming more optimistic as days go by. The projections for what we were expecting to see look like they probably won't eventuate. I don't want to jump the gun. I don't want to jinx us, but certainly what we're seeing is very positive here. And I think, can I say, and the reason for this is very straightforward. It's wide-scale vaccination before the virus came into Queensland. There is absolutely no doubt that the reason why we are doing so well is because so many of the Queensland population were vaccinated before the virus was introduced here. And there is no jurisdiction in the world that has done as well as Queensland so far. But it's not over yet. It's not over.
What sort of started to get on the other side of that peak? The question that I'd like to put to you as the Chief Health Officer is, would you like to start seeing people go back to work, not working from home, and eating back into a more simple, the life we used to?
We'll be going, yes, exactly. We'll, as we pass the peak, as we get on the way down, we'll review all our measures. We'll start talking more and more about this, both at a state level and a national level, about where the strategy goes. it's still not totally clear how the tail of this pandemic will play out. So there's likely to be a tail, and it's still not totally clear whether there'll be further waves, particularly going into the winter. But as we pass this peak, we are going to be regrouping, rethinking our strategy, both at a state level and a national level. Well, there were various models over the last since December. Most of the models talked about multiples of thousands of admissions to Queensland hospitals, multiples of thousands. And at this stage, in terms of the public hospital, we haven't reached 1,000. Probably combined with the private hospital, we'll probably have reached 1,000. But again, let's not jump the gun yet. We're not there yet. Brisbane still hasn't peaked. It's probably around its peak, and the greater Brisbane area. I'm talking about southeast Queensland. There were significant numbers of cases in Cairns in the last 48 hours, although the numbers in the last 24 hours appear to have dropped, but it's just one day. And I don't want to draw too much of an inference from one day. We have seen slight declines in the last 24 hours in pressure points like Ipswich and Logan, but it's just one day. So I don't want to draw too much of an inference from that. We like to see a pattern over 3 or 4 days before we get more confident. And here in the north side of Brisbane, I think that we're pretty close to the peak. The numbers are still up a little bit here on the north side of Brisbane.
When can we start talking about treating COVID like we treated it as an endemic disease? And can we really ever get to that point, given that COVID is a much more serious infection?
I think it comes back to what I was saying before. Once we're over this peak, we're all going to regroup, look again at our approach to COVID, I think, both at a state level, at a national level. I have a feeling that this tail will go on for some time. So I don't think it will be as simple as the flu. But with wide-scale vaccination, it is clear that hospitalisation rates, death rates, intensive care admission rates are completely different to what we were seeing in 2020, both in interstate, not in Queensland, thank God, but interstate and overseas. So this is a very different pandemic to the 2020 pandemic. A lot of what we're seeing, the most severe cases we're seeing in the hospital, are in fact the unvaccinated. So I think I said yesterday that 40% of people in Queensland intensive care units are unvaccinated. The extra dose, that third dose, does seem to make a particular difference in terms of your risk of being hospitalised and being admitted to intensive care. One of the critical decisions that will need to be made in the coming months is whether or not there will be another booster related to the Omicron strain. Those are all decisions that need to be made in the coming months. So I think let's not jump the gun too much, but we can breathe a little bit easier as it appears we're passing the peak, but let's not jump the gun. There'll be another phase to this.
Is Omicron the worst in your view of what we're going to get from COVID? Because people seem to think that the Omicron more infectious and also nearly as pathogenic as Delta and much more pathogenic than the flu has.
Look, I think it doesn't pay to speculate on whether there'll be other variants that will come forward. This virus will continue to mutate for years to come. Now, whether it will get worse, look, I think it becomes speculative. It's probably not the time to speculate. At the moment, we're still focusing on getting over this peak.
Minister.
One more question, then we'll see if one of our interns might say a few words. So.
You want to go first? Oh, it's
Me?
okay.
Thank you.
Okay, two last. Oh, I think that's rubbish. I think the opposition are just trying to find relevance right now.
I understand this is dependent on when the education minister as well again. Is there any indication yet when parents are going to find out that back-to-school plan? And have you guys actually finished the consultation on that yet?
Look, I believe the minister has, and she'll be, I'm sure, out and about very soon and be able to announce that before the school term starts. So.
If we go down that pathway of testing for teachers and students, do we have enough RAT kits available?
I'll leave it for the Education Minister to just talk about that, but I think parents can be very comfortable knowing that the kids can come back to school, and we've got everything in place, and we will have everything in place to ensure that. Oh, look, I appreciate that, but the school year will start back as planned, and before the kids go back, the plan will be released. So the parents will be able to know how we're going to manage any outbreaks within the schools and so forth. Now, I might just see if any of our clinicians... I'm seeing scared looks. Come on, Charlotte, we'll get you to Yvette.
Yeah, it's an exciting time to be starting work. It's something that not many doctors can say they've trained during a global pandemic. But yeah, it's something I'll remember for the rest of my career. I'm sure we all will. And yeah, it's exciting to be at work and be busy and feel like we're starting to help out in some way. A little bit, but I mean, we've been medical students the last couple of years in the pandemic, so yeah, it kind of just almost feels normal now. Yeah, it's good to be able to start work properly and yeah, be able to contribute a bit more. No, it's we still have to learn, yeah, all the normal things that doctors need to know, but it's just yeah, learning those things with the added challenges of COVID and the PPE and things like that. So medical school was 4 years, and most of us did an undergraduate degree before that. That's usually 3 or 4 years. 8 years. Yeah, it's our first week of work today. We've been doing placements the last few years, so been in hospitals, but it's the first time that we are starting to have more responsibility. So yeah, it's exciting. For me, yeah, it's a bit different for everyone. Thank you.